to talk about, okay, we're recording. Hope everybody's okay with that. It's a real pleasure to be here to talk about understanding self-harm and suicidal ideation. We're going to take a kind of a particular lens on that today, as well as kind of talking through potential signs, how to offer support and seeking help. We're going to really focus also on how we listen to understand and the difference between understanding and agreeing when we think about young people, especially who might be experiencing suicidal ideation. Okay, so before I go any further, I'm just going to talk for a moment about self-care. And with that being said, I know that everybody was going to be expecting both myself and Emily Kelly, our Executive Director. She is practicing as we preach and taking some self-care today because today is World Suicide Prevention Day. And we know that she lost her sister very sadly to suicide. She's taking some time out to care for herself, absolutely rightly. And so I'm so sorry you're going to have me alone. But as always, it's a complete pleasure to be here. Thank you so much for joining us. I just want to let you know, for those who've joined, that we are recording this just so that you're aware. Okay, so please, what I really truly believe is sharing in our emotions. And if you have big emotions, because this is a really big emotional topic, please feel free to do what you need to do to care for yourself. But I'm also going to encourage you to stay if you are happy to, because we are here to share in emotions, not to be alone with them. Yeah, so, but also if you need to step away, that's absolutely fine. And if you need support afterwards, then please do let us know. We're aiming to finish at 1:55 to 2. Okay. So we're going to be looking at self-harm and suicidal ideation and what that looks like when we're experiencing them. We're going to look at a few statistics and local data, the risks and the signs to look for, and then how you can support people. So just to remind everybody about what these experiences are. So self-harm is different to suicidal ideation, and we can have self-harm with and without suicidal ideation, very often without suicidal ideation. And this is when a person hurts himself as a way of dealing with distressing experiences, sometimes also painful memories or feelings that are overwhelming. And sometimes people self-harm to express something that's hard to put into words, to make a distress visible rather than invisible, to deal with physical pain instead of emotional pain, to reduce overwhelming feelings, or to escape memories, among others. And so suicidal ideation and the act of suicide is intentionally ending one's own life. And suicidal ideation can range from some abstract thoughts that one would never act on, feeling that maybe people would be better off without you, or you'd be better off not alive, thinking about different methods, and then making clear plans. So there's a range of steps and layers in terms of suicidal ideation. It's not on or off. And it's really important to understand that, so that actually when we understand that there are a number of steps and layers to suicidal ideation, it can reduce the panic that we feel when we hear about somebody experiencing suicidal ideation. Everyone's experience of suicidal feelings is unique to them, and it can be feeling unable to cope with difficult feelings or experiences, and feeling like you can't go on living in the way that you are, rather than wanting to die. And that's been a very common theme when I've seen young people at Alex's place previously, who don't really want to die but feel it's very difficult to go on living in the circumstances that they're living in. So a few statistics. I've cut down on this because we've been through a lot of these previously. Many of you will now know about the Inspire data research, the qualitative analysis that we did last year. And we've presented that a number of times and we've come up with a number of different themes. But the statistics are that globally, 1 in 10 children and adolescents are affected by mental health issues. Suicide is the second highest cause of death in the youth population. And then locally, 17% of our student population have considered death by suicide. And that's a total of 387 students on Ireland. That's huge. The Inspire data has helped us to understand the why behind that. And the why behind that has been a little bit more about it being a relatively hostile environment for them to live in, either economically here on Ireland, at school, sometimes at home, feeling like there's a lot of academic pressure because it's hard to get by here. And so, of course, performance and academic achievement being a real high priority in order to get by, quite rightly, for parents, for their young people, thinking my child has to achieve. And that's really understandable in this context in Cayman. And sometimes that being prioritized over emotional well-being. And so we're going to talk a little bit about that. And that theme kind of runs across many different settings. Then we have issues with there not being enough places to talk, or people feeling like they can't talk, or there's nobody to talk to, or nobody who understands. And so that Inspire data has been really important for us to understand the why behind the data that we've been seeing, the numbers data that we've been seeing from the Cayman Islands Student Drug Use Survey. I just want to say, actually, if there are any questions, please do put them in the chat, because I know that Renee is looking at those. And I also, that we will have time to answer questions at the end. Okay. So, what are the possible signs of self-harm? The most obvious signs to look out for are physical injuries that you will observe more than once, where cuts or scratches are too neat or ordered, often in horizontal lines on arms or legs, to be accidental and aren't consistent with how the young person says they were sustained. So, for example, I've seen a lot of young people who have self-harmed and they've told their parents that they were scratched by a cat, for example. And then when you look at the scratches, they're not consistent with a cat scratch. And then they're a little bit too neat and orderly. And so being able to say that out loud is really important. Other warning signs include secrecy or disappearing, for example, into the bathroom at times of high emotion, wearing long sleeves or baggy clothing, even in warm weather, that's really common. Increasing isolation or an unwillingness to engage in conversation, avoiding changing in front of others, for example, at PE, when you're shopping, trying on clothes, at sleepovers, and a hopelessness or aimlessness alongside a sense of lack of self-worth. Okay. And then possible signs of suicidal ideation, which is slightly different, there are the very obvious signs where somebody is talking about suicide and saying, I might as well be dead, or I don't know how to go on living. People writing a suicide note or a preoccupation with death or dying. Now, many people don't show those signs or say them in a very flippant way that can be really easy to miss. So it's kind of looking out for those, understanding if they're flippant or not. So, for example, in the local population, in some of the Inspire data we got, there was an issue with young people's everyday language that has changed from, for example, my generation, where the acronyms IWKM, I want to kill myself, have become part of a local and global slang. And so it's understanding the difference between a young person saying, oh, I've got nothing to wear, I want to kill myself, and I can't go on like this, I'm having thoughts of killing myself. And so actually digging into that and asking the question is really important, because generally the answer you're going to get from a young person will be different. So when I've spoken to young people about this, and they've said, oh, I might as well just kill myself. I said, you know, are you using that kind of as an off the cuff remark, or is that really how you're feeling? And if it's an off the cuff remark, they will tend to be quite jovial about it and laugh and say, oh no, it's just an off the cuff remark, I probably shouldn't say that kind of thing. Okay, which leads to one type of conversation, or a response of, actually, I really have been having those thoughts, yes. And that leads to obviously a very different type of conversation. So it's understanding that language, if young people are using it. And then more commonly, what we might see is a change over time, a more sustained change over weeks, if not a month or so, of a change in normal routines, especially in terms of eating or sleeping, a change in terms of locking yourself away in your room as a young person. So we know teenagers spend loads of times in their room. But what we're really looking for is a subdued mood alongside their locking away. And the locking away might be a change from before. And then we might see a general loss of energy or motivation. We might also see alongside that a neglect in hygiene or a change in weight, either gaining weight or losing weight. And then we might also see an increased or decreased use of drug or alcohol, or engaging in generally more risky or dangerous behaviours, like if a young person's driving in a risky manner, or like being in certain locations which might be viewed as more risky than their usual behaviour. The other things to look out for are young people, or people in general, saying goodbye in kind of a way that they won't see them again, like a very meaningful goodbye. So, for example, I have a friend who lost their father to suicide a good number of years ago now. And she talks about when she last saw him coming outside the door to wave goodbye to her and giving her a hug in a way that he wouldn't have done before. And it didn't stand out to her until after he had died. But she was like, I now realise that he was saying goodbye to me, and I wish I'd have realised that. So it's kind of looking out for those sorts of things. It's slightly less common. Also, that social withdrawal that we've talked about. And then again, slightly less common, but still something to look out for, is giving away belongings. Sometimes we have to accept that there are no obvious signs. And that is like the hardest time in terms of managing a death by suicide, is when actually there were no signs and nobody saw it coming. Sadly, there are those cases that we see, and we do see them here in Cayman, as well as globally. So who's at the most risk? Members of the LGBTQ community, certainly. And we've seen that in the student drug use survey as well, young people who feel a lack of belonging and connection. And we've talked a lot in APF about the importance of acceptance, belonging and connection and hope being the cornerstones of our mental health. People who've self-harmed before, and obviously we've acknowledged that that's different from suicide attempts, but statistics show that someone who has self-harmed is at a higher risk of a suicide attempt. And people who have attempted to take their life by suicide before is more likely to do the same again, because past behaviour is the best predictor of future behaviour. And so just being very aware. And obviously at Alex's place, we have and any kind of psychological therapy should be really keeping an eye on that from a risk and prevention perspective. People who've lost someone to suicide are slightly more at risk. And that's not because of any kind of genetic link. It's really because when we are very close to somebody who has died by suicide, the fact that they have done that makes that more of kind of more within our realm of something that we might therefore do. It's oh, they've done it, and therefore I could too. That's why we get what we call cluster effects, or the potential for cluster effects after a suicide, because people who are already struggling will see that somebody has taken their life and died by suicide, and will think, well, if they could do it, maybe I could. And so if you're close to somebody or related to somebody who has died by suicide, you're just at slightly higher risk. And so being able to understand that, the why of that, and seeking your own help when you have low mood is really important, and having good support networks. And then alcohol, drugs, and any form of sleep deprivation or sleep problems increase the risk of suicide. And so we need to be really aware of that for ourselves and others. Anybody who has had a child or any form of sleep problem will know just what a significant impact that sleep deprivation has. And certainly having had 2 children, one of whom really struggled with sleep, I felt incredibly low at times with one of my daughters afterwards because of that sleep deprivation. And then as you come out of that cloud of sleep deprivation, you kind of look back and realize how much you struggled, whereas it's much harder to see it at the time. So how can we help? Again, any questions on that, please put them in the chat and we will come to them. So how can we help? There are some real challenges in terms of seeking help that we need to understand in order to try to be helpful or to seek help. So we know that suicidal feelings are overwhelming. If they weren't overwhelming, they wouldn't be suicidal feelings. With support and help, the vast majority of people who experience any type of suicidal ideation go on to live fulfilling lives and are able to manage through that episode. But it really does take a good team around you, around somebody, to help them through that. It can be so difficult to open up to others about your feelings, because people often feel unable to articulate fully what they're feeling. Trying to find the language and the words for those feelings is very, very hard. We can be so unsure of who to share it with because feelings are so deep at that point and so difficult and feel so insurmountable. We can be flooded with concern that will not be understood or that will be judged for those thoughts and feelings, and worried that we're going to upset somebody with our thoughts and feelings. And so we don't want to be a burden. We keep it to ourselves. Burden, especially actually for people in the neurodivergent population, is a key indicator of increased suicide risk. So, as a professional or a parent, hearing that a person has suicidal feelings can be overwhelming in itself. And it's really common to feel panicked initially, of course, helpless and out of control. And that can really impact our response, and it can lead us to responding in a completely inadvertently dismissive manner. And it's when we tend to then use statements like, oh, you know, you'll get through it, don't worry about it, don't say things like that, you shouldn't talk like that. And that's generally because of our own feelings of panic and overwhelm. And if we can understand those responses and stop before we use them, or if we use them, then go on to say something else, that can be really, really helpful to somebody. It can be so difficult to understand those feelings if a child's or a person's life looks good from the outside. And even more so, parents can feel that their child doesn't really have any worries compared to their life that they had as a child. So many parents here that I speak to had such challenging childhoods, such challenging existences as children, that their children's lives just look so good compared to theirs. And so, of course, it's really hard to understand, how can my child be experiencing these difficulties when I didn't? And look how hard I had it. It's really natural to end up in that space. And so, actually, one of the key things that I tried to do at Alex's place was to help parents to understand and help children to understand their parents' challenges with that, which were completely natural. So, those can be really some of the barriers that we experience. So it's important to remember at this point that the majority of people who experience suicidal ideation go on to live fulfilling lives. And so with that in mind, if we can pause and take the time to manage our own regulation, to listen to somebody, then we can really understand the key difference between listening, agreeing, and helping. Okay. In order to listen to somebody's experiences of suicidal ideation, in order to understand that and then be helpful, it takes a great deal of emotional regulation for us as the listener. And I mean, that's been so true for me in my career, starting as a newly qualified or even just a trainee psychologist 20 years ago, trying to understand what I needed to do for myself in order to listen to young people, and then becoming a parent many years later and understanding that I am like the first person to at times talk over my children if I don't agree with what they're saying or I find what they're saying difficult to tolerate. And I really have to work at taking time to emotionally regulate myself in order to listen to them. And so what I've learned is, both professionally and personally, the difference between listening to understand and agreeing. And those two things are completely separate. And if we can understand that, then actually we can do a massive service to the mental health of a young person, whether that's our child or somebody else's, or a colleague or a friend. In order to do that, as I've said, emotional regulation is incredibly important. And so one of the key tools that I've used as both a parent and as a therapist is the one I'm about to talk you through. So I'll invite you to do it. I'm going to do it with you. Okay. You can't see my full body, but I'm going to put my feet. I can't put my feet on the floor in this chair because my feet are too, my legs are too short. But I've got my feet on a bar of wood. So I've got my feet on a bar of wood. So we say feet on the floor, and we ground ourselves with our feet on the floor. And if we take a moment to really feel our feet on the floor, then it helps us do this exercise even better. So we might think about which leg is heavier than the other, which foot feels like it's touching more of the floor than the other. Okay, where does our sock touch our foot? Where does our shoe touch our foot? Okay, so we feel our feet on the floor, then we feel our bum in our chair. You can give it a wiggle, it's okay to giggle. Okay, so feet on the floor, bum in the chair, back against whatever you've got behind you. So I've got a bookshelf, you might have a cushion or the back of a chair. So feet on the floor, bum in the chair, back against the cushion, breathe in. Shoulders up, round, back and down, breathe out. And rub your lips together. I call it lip balm. Just like that. So we're doing feet to face. Okay. My very good colleague and friend, Dr. Jennifer Robertson, taught me this, and I love it. Okay, so feet on the floor, bum in the chair, back against the cushion, breathe in. Shoulders up, round, back and down, breathe out. And lip balm. Feet on the floor, bum in the chair, back against the cushion, breathe in. Shoulders up, round, back and down, breathe out. Lip balm. And one more time, feet on the floor, bum in the chair, back against the cushion, breathe in. Shoulders, breathe out. Lip balm. And feet on the floor. We always end where we started. Okay, so my clients may not know this, but often when I'm listening to stories of trauma, I'm doing that grounding with my eyes open. Nobody would know, but it's helping me to stay in the moment, to not become panicked, to not knee-jerk react. It's helping me to listen and to understand. And so if we can do that when we're listening to a young person, or if we need to pause and take a moment to do it in order to continue to listen, it gives us a better chance of being able to respond with our wise mind. So what that exercise is doing, when we're panicked, everything in our cortex, in our wise mind, shuts down, and we go to our fight, flight, freeze part of our brain, which is our brainstem. Okay. And what that exercise does is it reduces our heart rate, it calms our central nervous system, and it allows us access back to our wise mind. Okay. So it's really why we end up responding in a slightly dismissive manner inadvertently, because actually responding with fight, flight, freeze. And what we want to do is respond with wise mind, with our cortex. Okay. And so that in that regulation, that exercise is one of the best ways to help us to remain regulated or to regulate ourselves in moments that we need to. And to become really good at it, just practice it morning, evening, and then use it whenever you need to. Okay. And so what that will allow us to do is to listen to a young person and to try to really understand how they've got to where they've got to, even if we don't agree with them. It's very common as a parent to have a different perspective to our child. I know that more than most. And growing up with very dismissive parents, I've been really wanting to do something very different for my children. And I commonly fail, but I really work hard at using this approach to try to listen to understand. And it is the greatest service we can do for our children if they're having mental health challenges, because it allows us to do that listening to understand. What can be then really helpful for us is to know that if we do that listening to understand, we'll then be able to come full circle to have a conversation about our perspective. But it's really helpful if we can listen to understand first. Now, it's never too late to listen to understand, okay? We can be dismissive and we can talk over and we can shut our children down. And then we can come back, we can circle back to listen to understand. So what I will do with my either young people I see professionally or with my own children is I'll say, oh, I'm really sorry, I've just spoken over you. I've realized that. Can we just start again? Please, can you help me to understand? what you're saying here. Okay, and I'm all ears. I've turned my listening ears on. Okay. On. Okay, and my kids are a bit younger, so things are generally not as serious for them. And I'll be a bit humorous and be like zip and dip. Okay, and they will laugh at me, and then okay, we're into playfulness, and then we're back in the room. Okay, if our children's challenges are a bit more serious, then playfulness may play a part, but it also may not. Okay, so it's about then your parental judgment as to how much playfulness and humor or not to use in those moments. Okay, but the message is it's never too late to circle back to listening to understand. Okay, we don't always get it on point to begin with. Okay, in fact, I rarely get it on point to begin with in parenting. I'm the first to hold my hands up at that. Okay, people think that because I'm a child psychologist, I've got it all sorted. And my kids are awesome because they're awesome, but I regularly get it wrong. I'm not wrong. I regularly make mistakes as a parent, and then I will try to repair. Okay, it's the repair that's important rather than getting it right all the time. Okay. So how else can we be helpful? Just going to do a little time check for myself. Okay. Talking to someone who can listen and be supportive is the first step to getting help. So if we're listening, as well as doing that kind of listening to understand, we can ask open questions like, how have you been feeling? What happened next? Tell me a bit more about that. Give them time. Okay, don't worry about the silence. Take them seriously. Okay, we don't want to dismiss. Even if we don't believe somebody would harm themselves, we still want to listen and take them seriously. And we're doing our very best not to judge, especially because we might feel shocked, upset, or frightened. It's important not to blame somebody for how they're feeling. Okay, because obviously it's been a big step for someone to tell you. If we find that we have done that, again, it's never too late to circle back. Okay. So, is it really safe to ask someone if they feel suicidal? We've talked loads about this previously, and I get asked this quite a lot. People are really afraid of asking these questions. But if someone is feeling like they want to die by suicide or they have any plans, the fact that somebody asks a direct question can really help to reduce the risk. So professionals absolutely recommend asking direct questions. So if we're having a conversation and we feel worried about somebody, we get to the point of asking, I just wondered if you'd ever felt or you have been feeling like it'd be better off not being alive, or if you've thought about dying by suicide. Okay, so we use direct language and don't feel afraid of using direct language. It cannot encourage someone to act on their feelings. In fact, the research is that it decreases the likelihood of someone asking, because actually people who are feeling that way feel relieved and less isolated when they're asked. And when I ask somebody and they're not, they will tend to say, oh my goodness, no, I've not been feeling like that. Whoa. I'm like, okay, just wanted to ask the question. Okay. So best practices: to listen and respond as calmly as possible, try not to make assumptions, to summarize back what somebody's saying to us so that we show we're understanding and that we're really getting what they're saying, that we're not misunderstanding. Don't worry about trying to finding solutions. Often these problems, these challenges aren't ones where there is an easy solution. And if you don't know what to say, it's okay to say, I don't know what to say to be helpful, but I'm just so glad you told me. That's always my default. If I'm like, I'm at a loss here, and that does happen sometimes, I'll say, look, I don't know what to say to be helpful here. I'm not sure I have anything useful to say, but I'm just so glad you told me. Okay. If people aren't ready to talk, or you're worried that they need to talk to somebody, but maybe they're not talking to you, thinking about who's the best person and asking them if they want to talk to another person. making sure there's an informal environment, or carrying out an activity like walking, driving, drawing, baking can be really helpful while talking. And maybe thinking about some young people feeling happier talking via messenger, text, or email. So being creative and using your knowledge about that young person or your own child. If you have concerns about somebody's immediate safety, that should be treated as urgent and as an urgent safeguarding issue, and that they should be dealt with in line with policies if you have them. Obviously, if you don't have policies, if you're a parent, then it's about thinking, right, do we need to seek help right now? I'm going to come on to that in just a moment. So keeping records of discussions and sharing with a safeguarding officer if you have one, because they can provide support and appropriate next steps. So it might be informing adults who need to know, like parents, SENCOs, teachers, pastoral staff, doctors, visiting the GP, visiting Alex's place, visiting the emergency room if necessary, providing access to a school counsellor, or getting help as quickly as possible, setting up regular meetings with a trusted adult that isn't always a counsellor. It might be a form tutor or somebody who a young person feels safe with. Obviously, any wounds that are present need to be appropriately dressed and cared for. So if anybody ever self-harms or attempts to die by suicide but hasn't died, getting help is absolutely mandatory. Okay, occasionally I've met young people who've made an attempt to take their life by suicide or has self-harmed and they haven't sought medical care. And it's really important that they do, to make sure there isn't infection, but also to make sure that they're appropriately safe. Okay, so the two places to go for serious and urgent issues is the emergency room or Alex's place at HSA. Treatment for suicidal ideation varies based on the level of dangerousness and safety threat. And that pertains to those layers that I was talking about before. When we assess suicidal ideation, we're looking at how serious is this suicidal ideation? Is it fleeting thoughts with absolutely no intention of acting on it, all the way up to very serious thoughts with plans, methods, dates, etc. Okay, so we need follow-up, we need talking therapy, we may need medication management, we may need inpatient hospitalization to ensure that a person is not at risk of dying. Okay, so Alex's place at HSA will see young people between the ages of 10 and 20, Mondays to Fridays 10 till 6, and is located in Georgetown Hospital. They're available for walk-in appointments. There's obviously emergency rooms available on island as well. And then we have local emotional support helplines. So the APF Kids Helpline, the phone number is here. There's also text available at the kidshelpline.ky. They're open Thursdays to Sundays, 3 till 9. K-Mind is the adult mental helpline, open Monday to Friday, 6 till 11. And also there's the number online, and the contact is kmind@hotmail.com. There's Teen Talk, ages 13 to 17, and that's a monthly session hosted on Zoom. It's currently being revamped, new dates to come. And then there's also Breaking Barriers, which is a monthly session hosted on Zoom the third Tuesday of each month at 6:30 p.m. Thank you so much for listening. Please, we are now able to take any questions.
Chantal, thank you so much for that presentation. So many people are saying that it's been so helpful, so thank you for that. I am looking at the chat, so I want to say the first question in the chat, right? So what has positively changed globally from 2018 to now that the suicidal rates have come down in the chart presented earlier?
I think actually that there is more understanding, more identification, and more services globally. Essentially, I think that the awareness of mental health issues, especially that really started in the pandemic, we saw kind of rafts of sports people and celebrities starting to talk about their own mental health. And so mental health stigma has been reduced. And we've also seen that in the CISTUS data on Ireland, which is absolutely fantastic news that there has been such a positive reduction in stigma. We have still got some way to go. We are by no means there, but it is an improving picture.
Okay. Someone just sent it, and this is a question that I can answer as well. Are you willing to do presentations to school staff? And the answer is yes. We just have you complete a request form, and that can be found on our website, or even by communicating that to our edu at alexpantonfoundation.ky. You can send us an email there, and we can get you sorted with that. So I'll put that email in the chat.
Fantastic.
So those are the only questions that needed to be answered in the chat. So the floor is open for others now.
Anybody else have any questions? I know this is a very big topic, and I hope that you're all okay. Please do reach out to us if you need any support, because it's important that we look after ourselves and each other. I'm a really great believer in kind of the goodness of humanity, looking after each other, kindness, compassion, and showing that to ourselves and everybody else. Okay. Right. Renee, it looks like that's
Sorry,
all.
Chantal.
Hi,
Hi,
Julie.
Julie. Hi.
How are you?
Sorry, very well, thank you. Shall I put the camera on or not? I don't know. Can't work out how to do it. Very practical question. You were asking about you talked to us about types of questions before to ask. Is it possible to put that slide back up again?
I expect so.
I think it was. Oh, what was it? Yes, it was when you were talking about, when you were talking about your own children and the kind of questions to ask. Right, where is it?
Here.
Oh, that's it. Yes. Oh, that's
Okay.
excellent. Thank you. So it was open questions, give them time, take them seriously, try not to judge. And I thought it was really reassuring, when you talked about it doesn't matter if you say the wrong thing, first of all. You can always go back. You can go back and revisit. You can go back and apologize and ask again about how they can help you to understand. Because I think it's very difficult sometimes to feel that you're saying the right thing. And that sometimes stops people because they don't want to make a situation worse.
Mm-hmm. Yeah. So when we want to circle back to a point in a conversation and we feel like, I feel like that wasn't the right thing to say, or that might have made things worse, then I will always own up to that. I'll say, I wonder if that felt dismissive, or if that felt like a really might have made you feel away in this conversation. I just want to check that out with you. And if it has, then I deeply apologize. Can we just go back to talk about whatever this, to talk about this again? Let me try to really understand you properly.
Right. Yeah. Well, thank you. Thank you for that.
That's okay. I think there's a certain vulnerability in admitting that we've made mistakes in conversations, and having the courage to own that vulnerability and to be vulnerable, I think, is a very human thing to do, but a very difficult human thing to do. And if we can do it, actually, it tends to benefit everybody around us if we show that vulnerability. but it means really taking care of ourselves, because we're admitting a mistake and taking accountability. And so then we have to be kind to ourselves about that.
Yeah. Thank you.
That's okay. Thanks for asking, Julie. Okay, any other questions? Right, well, thank you so much for your lovely feedback. And we will obviously have more lunch and learns going forward. Please do reach out to us. There are some different contact points in the chat that Renee has very helpfully written. So please do make note of those if you want to contact us. Renee, I'll hand back over to you just to finish off.
Yes, and before anyone goes, I am about to send the September 2025 Lunch and Learn link in the chat. So just give me a minute to send that so you all can complete that before you go, okay? So thank you so much for joining. So just give me a minute.
Okay, so there's an evaluation, I think, which I think we'd be more than grateful to you for filling out. And I hope you all have a very good rest of your day. Yeah, thank you, Leslie. It's not an easy topic, you're right, but it's so important to speak about it out loud. And yeah, definitely for adults too, of course.
Okay. Thank you, Chantal. Thanks. Bye.
Thanks. Okay, I'm hoping that the link is in the chat. Have you managed to put it there, Renee?
Not as yet. I'm so sorry. The SurveyMonkey has given me a little bit of a difficulty, but I am sending it right now.
What's that? Technology's causing problems? What a shocker.
But yes, so if you all can just complete that for us, that would be great. And there's one more question actually. Are you able to do a session specifically for adults?
I mean, I'd be interested in what kind of APF thinks, but yes, I mean the APF range goes up to 30, so actually we probably could do a session aimed at adults, given that age range. So Renee, maybe we could think about scheduling that in during the lunch and learns in the year.
Okay, sounds great. Thank you. Let's see if there's one more. Yes, there is one more.
So I can see that from Sheila.
Okay.
So it depends on the age of the children. For example, we have been into secondary schools to talk specifically to children about suicide ideation and self-harm and mental health in general. With younger children, we don't tend to talk about suicide ideation, but for example, we might talk about like mental health and well-being with younger children and how to look after. So 12 to 13 years, yes, we would start to certainly talk to both teachers and staff and children. Actually, I think at APF we would do any of those. Am I right, Renee?
Yes, you are.
Marvelous. Oh, we're just getting information that it's not quite the right survey, Renee.
Okay, sorry. Okay.
Okay. So I just want to thank everybody again for coming. It has been really fantastic to talk to you all about this. on World Suicide Prevention Day. Please all take very, very good care of yourselves. Today, there are a lot of people who are touched by suicide. And so it's important that, everybody has awareness for themselves and others today, and any other day, actually, around this. Are we going to send this out, Renee, in email, or do we want to just try and stay on for a few more minutes?
Just a few more minutes because I don't have everyone's emails here. So
okay, Renee, if you don't mind, I'm going to jump off the call, but thank you so much to everyone for coming today.
I'm sorry, y'all. This is giving me some difficulties, this platform. So if you just want to leave your email address in the chat and I'll collect that and I'll send it to you, whoever sends me their email. So I do apologize for that, everyone. But just send me your email so I can get the survey back to you. Thank you.